Hello everyone, it is 11 o'clock, so we will start. Alors, bonjour, nous sommes prêts à commencer. J'aimerais vous souhaiter la bienvenue aujourd'hui à notre conversation sur le bien-être au sujet du cancer et intimité avec Zoé Vourantoni. Madame Zoé est une sexologue clinicienne et psychothérapeute, graduée de la matrice en sexologie, profil counseling de l'UQAM et d'une baccalauréat en psychologie de l'Université de Montréal. Elle pratique comme sexologue clinicien, psychothérapeute au bureau privé. Depuis 2009, elle a fait carrière et réadaptation physique au Suisse Centre-Sud de Montréal. Elle est également superviseure des stages cliniques niveau maîtrise pour le programme de sexologie division counseling à l'UQAM. Depuis 2010, elle agit également comme conférencière à différents niveaux. Alors, just want to introduce Madame Zoe. So, a clinical sexologist and psychotherapist, graduated with a master's degree in sexology counseling at UQAM and bachelor's degree in psychology from the University of Montreal. She has been practicing as a clinical sexologist, psychotherapist in a private office since 2009. She made a career in physical rehabilitation at the Suisse Centre-Sud de Montréal. She is also the supervisor of clinical internships at the master's level of Sexology Counseling Division program at UQAM University. Since 2010, she has acted as a lecturer at different levels. Also, I want to share today that my colleague Sabrina Burr, hi, if you want to say hi, Sabrina, she'll be facilitating today's session. I would also like to acknowledge Dr. Mark Hamel, Dr. Virginia Lee, and Chantal Leblanc for their valued collaboration with the conversation today. So, je veux dire que ma colloque Sabrina, aujourd'hui, animerait la séance. Je tiens également à remercier Dr. Mark Hamel, Dr. Virginia Lee et Mme Chantal Leblanc pour leur précieuse collaboration. Also, please note that this event is being recorded. Please place your camera off and microphone on mute during the recording. And if you'd like to ask a question, please raise your hand and or write your question in the chat box that you see at the bottom of your screen to the right. Alors, pour aujourd'hui, cet événement est enregistré. Veuillez éteindre votre caméra et à désactiver le son de votre microphone pendant la présentation. Si vous souhaitez poser une question, veuillez lever la main et ou écrire votre question dans la boîte de discussion. Alors, merci beaucoup. And Zoe, we are ready. Thank you.
So hello to everyone. My pleasure to be here. Give me just a moment to set up my presentation. Donc, bienvenue à tous les participants. La présentation va se faire en anglais. Par contre, les diapositives ont été montées en français afin d'assurer le plus possible le fait que la présentation soit bilingue. N'hésitez pas à la fin ou à travers le chat de poser vos questions en français. Je vais tenter d'y répondre le plus possible dans les deux langues. So today, as you can see, the presentation has been put together in French. I will presenting as much as possible in English. The idea of it being perfectly bilingual and to hopefully get the information out to everyone. So my pleasure being here with you today. We're going to be talking about cancer and intimacy and hopefully how to move forward with that sphere of your life and keeping it alive, either for yourself or for your relationship, or the hope of developing something in the future as you're facing this difficult time. So when we talk about, so from my training, as you heard with my introduction with Rola, I'm a sex therapist, psychotherapist. Really the idea that for me, touch, being intimate, being in relationships is part of who we are as human beings. And that it's very possible that right now, either you're feeling bad because you feel that you can't or don't have the desire to be in an intimate relationship or very sexually active relationship with your partner, and that you feel that you're depriving them of something. Maybe you feel ridiculous for actually desiring sexual relationships and feeling bad that you don't have that, or feeling that you're having sexual desire when you're facing this diagnosis or going through treatments and feeling like, well, I should have other priorities, or I shouldn't feel bad that I don't have the sexuality that I want, for example. Maybe you're here as a partner, or that you're worried about your partner and that you feel bad about having desires or wanting to be close to your partner, or maybe you're worried about putting pressure on them or wanting to respect their boundaries and not knowing how to sort of deal with that reality. So to know that your sexuality, even if you're not sexually active in the present moment, that it's still part of you as a human being, and it's still a very important sphere of your life, and that feeling that you are desirable, or that it's something that you can get back to, or that it's something that you have in your life, is really something important, contributing to your self-image, to your self-esteem, and that it's something that can be very positive in your life, whether you be in a relationship now or not. So today, obviously, there's so many things that I could talk to you about, and we can continue over hours and hours and possibly days. But what I really hope that you get away from this talk is that either I begin or plant a seed or help you to continue in your thought process towards how to keep this aspect of your life alive through going through treatments, through your diagnosis, if you're on the tail end of what you're going through, how you want to reconstruct afterwards. So I really hope to encourage you to nourish and live your eroticism, and to open your dialogue, whether it be to permit yourself to ask questions to your medical team, to bring up difficulties that you've been having, or figuring out, is this something that's tied into my diagnosis, to my treatment? Is there things that I should be worried about? And discussing that with your medical practitioners, discussing that with your partners, or discussing it with friends and family about how hard it is, or the worries that you have, just to feel less isolated, and to less be the monster underneath the bed, or the thing that's eating away at you in your mind. And I hope to inspire you and bring a little bit of creativity on how to continue exploring your sensuality, or to live that sphere of life in whichever way makes sense to you now, and for whatever time you need it to be that way, and for it also to be evolving. And it can be changing from day to day. It can be changing from week to week or month to month, depending on where you are. So I'd love you to think about the fact of, well, what are my motives for being sexually active, or for having sexual intimacy, or for living my sensuality? That most probably it's the idea of having pleasure, whether it be physical, whether it be emotional, whether it be for having quality time, either quality time with myself through masturbation, giving myself pleasure, or in my relationship, whether it be for creating that connection, for feeling close to my partner, whether it be to get affection, whether it be to, relax and sleep better because you do after a really great orgasm, whether it be to manage your pain. So maybe some of you have figured that out, that if you're having a lot of pain, actually when you're feeling sexual excitement, when you're having an orgasm, that the endorphins can actually help with pain management afterwards. And maybe you are in a period of your life where you're thinking of procreation, and that you're worried about what are the possibilities, or how's my diagnosis going to affect that. One thing sexuality is not, but can tend to fall into that trap, or the dangers are when all of a sudden the sex has become complicated because of pain issues, because of lack of energy, because of any kind of psychological distress that we're going through, and that we feel that we're not meeting the needs of our partner. All of a sudden, our sexuality can become oriented towards, we absolutely have to reach orgasm, or there has to be penetration if you're in a heterosexual relationship, or there has to be a certain sexual script that we stick to, or I have to make sure that the other person is satisfied, or from fear of losing the other person, that this is something that I absolutely have to give them. And then all of a sudden, the idea of pleasure, of connection, of it being something positive for us falls away and becomes something that can be incredibly negative, that can generate a lot of anxiety, and all of a sudden becomes another problem in your life. So to be very attentive to and careful of falling into the idea of it has to be a certain way, or being very demanding towards yourself or the other person. So how can a cancer diagnosis affect you? It can be in a direct manner. So directly from my diagnosis, maybe I have a lot of fatigue, or from my treatments, maybe I have nausea, maybe there's been alterations in my body image, or it can be indirectly. So in the idea of, because of what I'm going through, I'm not as available, or I'm worried about losing the other person. And then that anxiety has had an impact on my availability to be sexually active, or it's affecting my sexual function. I'm having trouble reaching orgasm, or I'm not getting as excited, or I'm having trouble with lubrication or maintaining my erection, whatever it may be. And can affect you on 3 really large planes. So it can be physically, it can be psychologically, or in your relationships, or your confidence to build a relationship, either in that point in your life or afterwards, of how am I going to deal with this? How am I going to present this? How would anyone ever accept with the possibility of a relapse, or the scars that I have, or the surgeries that I've had? And in these, either be directly or indirectly, and on a physical, psychological, or relationship level, the big impacts that we see on sexual function can be diminished desire. It can be a difficult reaching a sexual excitement, so whether that be obtaining or maintaining an erection, or having sufficient lubrication to have non-painful sexual interactions, or difficulties with orgasm, either reaching orgasm, or them not being actually as satisfactory as they've been in the past. So from that, I'm really looking quickly into the ideas of, and I want to get into more of the solutions, but looking quickly into how is it affected. So physically, it can be side effects of your medication, your treatment. It can be pain or fatigue from surgery or radiotherapy. It can be chemotherapy perhaps has had an impact on your vascular function, on your nervous function. It can be nausea. I'm sure it's difficult to feel sexy and desirable when we're having a lot of nausea. And it can be any kind of modification to your body image, from scars, from lumps, from gaining weight, from losing your hair, to any kind of way that your self-image is impacted. And then you could have, this is really not my area of expertise, but when I was talking about asking those questions and allowing you to open up with your medical practitioners, things that people are very often worried about. So there can be questions about fertility. So opening up those questions with your medical practitioners, and or it can be the idea of, is it safe for me to continue? So if you're singles, it's safe for me to continue meeting people in terms of the fragility of my immune system, or asking questions about the fact of birth control. Is it as functional with the treatments that you're going through? So there can be things that you might be worried about, and definitely to open up with your medical practitioners. On a psychological level, so there can be, and very often what I see is people that are dealing with diminished self-esteem, so loss of all your points of reference, feeling like you have nothing to offer to anyone else, or that you're not interesting, that you would be a weight. And often the fears especially lead it into sexuality, when we talked about the goals before, or falling into the dangers of feeling like sex has to happen a certain way. So we can be very fearful of pain or fatigue, or I'm not going to be able to complete a sexual interaction. I say with quotations, and the idea of, if everyone's kind of done having fun, then that's enough, right? But if we get into sexuality, or living our sex life has become a little bit more complicated, or it's not happening to the way that we would desire, then all of a sudden there can be much more sentiment of failure because I didn't reach orgasm, or I wasn't able to have penetration, or we didn't do all the sexual acts that we usually like to do. So there can be the fear of, I'm not going to complete. So coming back to the idea of, well, we're supposed to be connected, it's supposed to be fun, it's supposed to feel good. So maybe if I don't have to get to those, we can focus on, well, what felt good? What was fun? A fear of rejection. So if I'm not feeling desirable, then I might fear that I'm going to not please the other person and not go towards them. So again, that idea of failure, and so there can be also the idea I'm fearing that in terms of my own survival, or if I'm going to have a relapse, so that's going to be difficult for another person. There can be alterations of our body image. So lost muscle mass, I've gained weight, I've lost my hair, or maybe I'm worried about scars that I might have, or maybe I've had an amputation tied into my diagnosis. So any kind of, or maybe a physical alteration. So I'm thinking about women that I've worked with that have had breast cancer, and have had loss of their breasts, or implants, and never thought that they would be the type of woman to have those kind of feeling, well, who am I now, or how do I identify myself? And what that can cause also is turning into yourselves, pulling away from your loved ones and keeping those emotions for yourself, and obviously diminished sexual desire, feeling, if you're a younger adult, feeling that you're late in life, maybe your friends are moving on and having relationships and building families or moving forward in their jobs and feeling like I'm not there yet, or am I ever going to be, and feeling like you have to catch up. That all of that can have an impact on how sexual you feel, how desirable you feel, or how open you are to that sphere of life. And obviously there can be a lot of comorbidity tied in with a depressive diagnosis or a diagnosis of anxiety. Relationship wise, if you're in a relationship, obviously kind of everything gets thrown out the window in terms of balance. It can be difficult to allow someone to be your caregiver. It can be difficult to feel sexy and feel desirable when we're receiving that help, or as a caregiver know how to and what are the boundaries of that role, but to still stay and feel as lovers. It can create a sentiment of being dependent on another person where all of a sudden we're feeling very insecure. I'm sure that some of you are feeling more fatigue, or you have anxiety, and we tend to be a little bit more irritable, or we don't know what's coming next, having trouble dealing with insecurity. So everyone is kind of on edge, which makes communication and toleration of tolerating little difficulties a little bit more difficult. There can be distance between partners, either physically because I don't like to be touched, or we're maybe sleeping in separate beds because I'm having trouble sleeping, or emotional because I've turned into myself. There can be major modifications in your lifestyle because maybe your financial situation isn't the same, for example. And no relationship is perfect. So anything that was a bit of an issue before might actually be amplified by this new situation or these new stressors that are in your life. So you might have lost someone who's unable to deal with your diagnosis, or worried about that happening. If you're on your own, maybe you're worried about meeting someone, or how am I going to do that? Or how am I going to present myself in the future? Maybe you're feeling really isolated and lonely. Maybe your friends have really changed in terms of thinking about how am I going to connect with people, or the people I thought that were going to be there for me aren't, or the people that I didn't necessarily think I could count on, I can, and how do I deal with those changes? And there can be a lot of, elephants in the rooms, or things that aren't directly said in terms of communication, that can create tension, whether it be in romantic relationships, family dynamics, or with friendships. So what happens then with all those circumstances? Well, maybe I'm going less towards my partner, but maybe my partner's coming less towards me as well, through fear of putting pressure on me. So our partners come less towards us because they don't want to be rejected themselves, maybe because they know you're not in a sexual mood. Maybe they don't want to put pressure on you. Maybe they're fearful of hurting you, or know that you're not necessarily comfortable with a scar, with your weight gain, and not knowing how to manage that. So from the diminished sexuality, through fear of being a tease, or thinking that the other person, our cues of affection, would be starting something that we're not sure if we can deal with, there tends to also be diminished affection, diminished touching. And then we feel from that less desirable, and we feel less desire as well. So all this obviously has an impact on our self-esteem, our confidence, our sexual desire, and can make it even more difficult to communicate, again, in these elephants in the room. So how do we get out of that? Because obviously I'm sure that none of you, if you're stuck in that, would want to stay there. So to come back to this idea of, why do I have sexual interactions? And what do I want out of my sexuality now in my life? Or what do I need? So what I had maybe a year ago, or 6 months ago, or 2 years ago is not necessarily what I need now. So to question yourself on, why do I have sexual interactions? What do I want to get out of it? And right now, where I am in my life, what do I need, or what would I want my sexuality to be? So again, coming back to the idea of pleasure, whether it be emotional, whether it be physical, whether it be quality time for yourself or for your relationship, whether it be creating connection and feeling that you're close to someone, whether it be receiving affection and building that relationship. So there's definitely solutions that are out there, and that's what I want to get to a lot more today. Solutions that you can put in place for yourself, solutions for your couple, solutions for people who on their own, and solutions in, well, the how are we going to do this? So solutions for yourself really come back to the question that I was asking before. What do I want in my sexual sphere? Where am I as a person now? And not to necessarily just wait. Sometimes people will on the perfect day or the perfect moment, I'm going to want to be sexual with my partner. So to not necessarily wait for that right moment, but to think about the fact that, well, maybe it would feel good to, receive touch, or just to feel a little bit of the butterflies in the bottom of my belly, and to not necessarily wait for the right moment, and to take charge. So to get familiar with your body again, either that you've been through treatment and your body has changed. So maybe I have curves, or maybe I'm slimmer than I used to be, or maybe my hair is growing back in a way that I would have never picked. How can I like where I am, or how can I learn to deal with my scars? And I think from that, sometimes we get a lot in society, in media, from women that have survived breast cancer, being survivors, or I'm a cancer survivor. And if that resonates as true, wonderful. But I think for a lot of people, that's not necessarily where they're at that close, either in treatments or very quickly when they've gotten to the tail end of treatment, or if you've just gotten a diagnosis where you're certainly not thinking that yet. And I think the idea of being able to look at your body as if weight gain or loss of hair or scars or loss of a body part is very difficult. And I'm not minimizing that at all, but saying, if this is what I have to go through to make it out on the other side, is this something that I can learn to live this? Is this something that I can take? And I find that for a lot of people that I've worked with, is something that has been helpful. So getting to know that body, of what works for you, what do you like, what can still be cute, well, what does my partner appreciate, or what feels good. If there's things that have changed in terms of sensation, if there's things that are painful, what wouldn't be painful, or what would feel good. Using relaxation techniques that might sound silly, but if you're really anxious and that you're oriented towards performance, or you're worried about going towards your partner, then focusing on relaxation and letting go and breathing through and getting yourself in the right mental headspace, and allowing space for errors, for imperfections, and therefore trying. So maybe you find a solution and you're sure it's going to work, and it totally bombed. It doesn't matter. You thought at a time of the day, or that you feel better, I don't know, keeping your bra on, or whatever it may be, and it doesn't work out, or it didn't work out as you thought. Hey, that's okay. So being flexible and being creative and getting to know kind of what works well for me. So if I had a nap in the afternoon, then maybe I had the energy, or a little bit before, or taking the time to connect with my partner, and using humor. So the idea, when you try something and it doesn't work, it doesn't have to be dramatic. It can be lighthearted, and it can be funny, and it can be something that actually creates connection through this big, it didn't work out, and we're going to laugh about it. So ideally, your team of practitioners would talk to you about side effects on your sexuality medication, want to check in on how you're doing, emotionally, if they know that you have a partner. But it's possible that they don't, because they forget, because there's so many things to address in your appointments that you have with them, that they're prioritizing information, or maybe they have their own discomfort with sexuality. They're human too. But that know that you have the right towards that information. So permit you to ask questions about, what are the impacts going to be about treatment on my sexual function? Can I continue with my sexual function? Are there things that I should consider? Is it going to have an impact on my fertility? What are my options? Is it going to have an impact on my birth control? What are my options? What are other resources that I could work with to help me? So physiotherapist and perennial re-education. Do I need to work with a psychologist, a sex therapist? Or any other questions that you can have about your sexuality. So to not be shy, and that there should be space, and they probably do want to address that, but there might be a whole bunch of things that get in the way if they don't. So don't think, oh, because they don't address it, it's not a priority, or I shouldn't. Allow yourselves to open up those questions. So the idea also of being proactive in noting, oh, you gave me a medication to help with sleeping, or maybe it's been really difficult mood-wise, and I've been put on an antidepressant, and I'm noticing that I'm having trouble reaching orgasm, or my sexual desires change. So allowing yourself to, when did this change? When did things start to change? So to be able to reflect and help your medical practitioners find solutions or figure out what's going on. And if you have a partner, maybe they want to come, or maybe they have questions. So inviting them to come to your medical appointments, and if they have questions, or if there are things that they want to know about. So you can definitely take some time on your own, but maybe they can be there for part of the appointment. solutions for the couple, when I was talking about reaffirming sort of like what your objectives are, something that tends to be very helpful is opening that up with your partner and being worried of like, well, I'm worried that I'm going to let you down if I don't want to have penetration, or I don't want to start if I don't reach orgasm, that you're going to be disappointed, or I'm going to let you down. So kind of reaffirming together, well, what are we doing? So that means communicating before, during, after, using I statements, how I feel, what I would want, what I think would work for me, how I feel about the solution. Well, hey, we tried it, we thought it would be a good idea, and you know what, I didn't necessarily feel so comfortable, or do I not want to do that again? Is there something that I would think would be good to readjust it? Giving yourselves the time to seduce yourselves and get back into such sensuality. So maybe it's just a simple date initially, maybe it's taking the time to cuddle, maybe it's having a makeout session like when we were teens. Hey, we don't ever necessarily go back to that. So explore and try to do a little bit differently. So we tend to eliminate things. Well, this didn't work, and that didn't work, and that didn't work. Well, there's nothing left. So kind of thinking, well, this didn't work. How could we do it differently? And what do I need? Or what am I trying to get to? Well, I just really want to feel connected because I don't feel sexual. Or maybe I'm just really not sexual, but worried about my partner. So maybe we could just talk about it for now and kind of know that it's okay that we're kind of taking a break for a few weeks, a few months, whatever it may be, but I'm going to stop feeling guilty because we've talked about it and addressed it. So to have a wider repertoire of what our sexuality is. So maybe it's taking a bubble bath together and we feel sensual and we feel connected. And maybe it's actually having penetrative sex. Maybe it's me giving pleasure to my partner because I still have the energy and the desire to do that, but I don't feel like I'm in a sexual place. And again, using humor, getting things ready, preparing yourself. So I don't know if you want to use a vibrator on your partner. It'd be nice if it had batteries and was clean. It was in the room where you wanted to use it, right? And having a plan B. So if we planned a date and we thought we were going to have the energy, but if it doesn't work out, what do we do? So we don't kind of just stop in the middle and both of us feel bad. So it's like, well, I would love it if we could take the time to cuddle, or if we don't have the energy, or if we have to stop during, or we stop earlier than we thought, it was still good, but we don't have the desire to continue going for whatever it is that we wanted to do. I would love it if we could cuddle, or when we watch a movie, or can we make sure that we still have a couple's moment together, however we want that to look. If you're on your own and you're worried about, what my next steps are, know that taking care of yourself. So getting information for and being ready for the moment where you want to meet someone and connect. So whether it be talking about your birth control, talking about how safe is it for my immune system to meet people, to go on dates, is that something that I can do now? Be really invested in your relationships with friends and family and allow yourself to count on them. So for a lot of people, it's completely okay to count on a partner to come to medical appointments, to pick us up, to help us with meals or getting our house together or whatever it may be. But then we won't necessarily allow ourselves to count on friends and families, and think a lot of people are like, hey, let me know whatever you need. And then we kind of don't know. So often for friends and family, I tell them, take an initiative. What seems difficult for that person? Like, hey, I'm going to the grocery store. Let me pick up some stuff for you. Not like, what do you need? Do you need anything? They're going to say no. What can I pick up for you? What do you want? Or like, hey, I've cooked a meal. I brought this over. Hey, what are things that like your nausea that you're eating right now? So taking that initiative, but also if you're the individual, kind of like allowing yourself to ask for that and recognizing that your loved ones want to be there for you. So putting into perspective also, well, what is my priority right now? Is it I just want to get to feel comfortable in my body? So do I want to work with a therapist? Do I want to take some time in front of the mirror and figure out how I'm going to live with these scars, or the pounds that I've put on or lost, or the muscle mass that I've lost, for example? And then imagine yourself actively and positively talking to someone about what you've been through. So if say I do want to meet someone, how would I present this? When? And obviously there's not one right moment. And even for yourself, if you kind of figure out a scenario, it might change from person to person or date to date. And to visualize yourself in an enjoyable date afterwards, whether it be after treatment or whenever it is that you're ready. One big thing that I see for people that are single is imagining or deciding for the other person that they're going to be a bother, that they're going to be too much, or, I talked about this and they seem to be surprised, so I'm going to assume that it's not going to work for them. I'm going to end it earlier. Don't think for the other person. Let them decide and let them be, master of their own domain and a consenting adult. So if they have insecurities or there's something that they're worried about, they can open it up with you, but don't guess and don't take initiatives on their behalf. When I talk about execution in sexuality, so a tool that I really like and that I use with pretty much everyone that I work with, but I think is even more pertinent when we're going through health issues that can make it a little bit more difficult or unpredictable as how I'm going to feel. Very quickly, if someone comes on to me and I'm not necessarily feeling sexual, whether it be because I'm tired, because I have nausea, because I was doing the dishes and I just wasn't in that headspace, it's very easy to quickly say, oh, no, I'm not in the mood now. So because obviously that's not where I was there. And even to know that the other person that came towards you didn't spontaneously out of nowhere, like, oh, I have sexual desire, I'm going to go up to the other person. They were probably thinking about it, milling over it, figuring out how to approach you. So they've kind of gotten their mojo going. So when they come up to you, they've already started. So if you're the person that's coming up to someone, give them a moment to catch up to you and think, what can I do to slow myself down and help them speed up? If you're the person that's being approached, that you kind of, or that you're curious or kind of have it on your mind, but not sure if you're ready to go all the way, again, all the way being wherever you've had enough fun. I love the idea of telling yourself, well, maybe, or let's see. So let's see how it feels to hug, and let's see how it feels to maybe be caressed a little bit, and then maybe to kiss, and then maybe to start fondling, and then maybe to move on to something that's a little bit more either sensual or openly sexual. And the idea being, if we've communicated beforehand, you can stop at any moment. And very often people have that fear of, if I start, I have to go all the way through a sexual interaction until both of us or one of us is sexually satisfied or has reached orgasm. So what's interesting is to have that talk with your partner beforehand of, if I'm not feeling it, or if my sexual excitement doesn't come up, or my sexual desire doesn't kick in after kissing and caressing, even though that's felt good for a few minutes, maybe I'm going to want to stop there, or maybe I would feel good and I would be okay with continuing forward, but not doing more. So if we've talked about it beforehand, a lot of people are fearful that their partners would react very negatively or be insulted to that. And when they open up that talk, the response that they most often get is, I would much rather have access to a little bit of you than none of you. And I would much rather you set a boundary and tell me when you've had enough than to force yourself into something that doesn't feel good and pleasurable. So yes, absolutely, I would like to spoon with you and for us to caress each other a little bit, or maybe kiss a little, and or even if I have an erection, or even if I get sexually excited and we don't go further, that's okay. Or if we're in the middle of penetration and starts being uncomfortable or painful, or you're not feeling it anymore, I really do want you to tell me to stop and not push yourself to keep going. So in the very, very mass majority of situations, when we allow ourselves to open up the discussion, that's the response we get from our partners. They're like, well, initially I might be a little bit surprised, or I might be a little bit disappointed in the moment because I was enjoying, but I absolutely want you to stop, or I absolutely want to have a little bit of you and none of you, and that's okay. Like, kind of give me a moment to manage myself and I'll be fine. So the idea also of taking more time for preliminaries, which to me are sex, but if I'm having trouble getting there, sometimes I find that a lot of people fall into the strategy of, I'm going to go faster to get it over with, but that's not helpful. So the idea of taking more time and working around the erogenous zone, so the tickling on the back, or allowing yourselves to kiss longer, and then it becomes better and we open up to it, and then maybe that's when my sexual desire starts to come up. So actually slowing things down often helps us go further and not falling into the reflex of wanting to speed things up. And permitting yourself to have a little bit more of a passive role. So if you're kind of into it, but you don't necessarily have the energy, well, maybe letting your partner take care of you, and that's absolutely okay. If you're having pain, or if you've been in surgery, you have medication that works for you, kind of thinking, do I want to take it beforehand? Or if you had a surgery and you're worried about being a little bit sore afterwards, can I stretch or take a pain medication or take a bath, or can I use ice, or just something that would help with that? So know that it's your sexuality and that it's supposed to be fun. So even if you want to procreate, and even if you're there in your life, at the basis is supposed to be something that's enjoyable. It's supposed to be something that's fun. It's supposed to be something that brings connection. So allow yourselves to slowly and progressively get in tune with yourself, with your partner, and know that the changes in your reality might be obvious, but don't assume that the other person knows or understands what you're thinking or what you're going through. Question, talk about it, don't let that pink elephant be in the center of your room. Debunk that. And it is much worse to assume that the other person doesn't want you, or that you're not desirable and that you're making a mistake, than to actually question and open it up. And it's even worse to put that under the rug and think like, you know what, just let's forget about it and later. And it's okay if it's let's forget about it later because I'm not there. But if it's openly been discussed, and then therefore maybe there's still room for affection and emotional support because you're not feeling sexual right now in your life, and probably your partner can definitely understand that, but let's talk openly about it so that we're not tiptoeing around it and wondering, and maybe we're getting an it's okay from your, and your partner says it's absolutely okay, and tell me what you need. So more often than not, when people are able to open up that dialogue, it brings an immense amount of resolution and diminishing the anxiety and pressure that they're feeling, and just having a lot of breathing room. So I really encourage you to be courageous. It's worthwhile, and I know how vulnerable we can feel when we open these talks, and how uncomfortable and unsettling it can be, or even trying new things in your intimacy, or changing things up to how it were. But try again, adjust, because it is certainly worth it. Here are a bunch of different resources that I think that are accessible to, if there's something that you want to look into. So the clinic at UQAM, McGill has a sex and couple therapy service. There's different organizations, both professional orders that I'm part of. So not being shy to reach out and get support, or ask your medical practitioners if they have referrals for you. Certainly don't be shy.